look at it in a way, you can look at it as a service rather than a product. So if you have allogeneic uh, cell therapies, allogeneic cell therapies are a product, sort of similar. You grab it off the shelf, but the autogenous T cell therapies are really you're taking those cells from a patient and you are performing a service for them and then handing it back to the patient. So that's expensive.
Jim, there is a question on
$500,000.
Sorry, Jim. There's a question. How long does it take to make the autologous product from taking the cells out of the patient to putting them back in?
2 weeks. So it's the autologous, yeah, 2 weeks. Yeah. And again, the patient only usually has a month, but in a lot of cases, the CAR T cells go in and the patient is riddled with cancer cells, and the CAR T goes in and eliminates, and they're tumor free in a few weeks. So patient success rate 80+%. So it's really successful. The problem with it, as you said, is it's expensive. It is not clear though. Currently, all of the applications are leukemias. They're single cells that the CAR T cells are going after. It is not clear it will work on solid tumors. Everyone thinks it will, but it is not clear. And then there are alternate therapies coming up. Tumor infiltrating lymphocytes are another that there's a lot of action. Natural killer cells, and so these are in the pipeline as well. And then induced pluripotent stem cells to produce the T cell to produce the allogeneic treatment that some companies are working on as well.
Thank you, Jim. So I think in the interest of time, we'll move on with Russ, and we'll come back to questions a little bit later if there are any more.
Yeah.
It's all you, Russ.
Well, thanks, Maggie, and thanks, Jim. First of all, I just want to say it has been just an absolute pleasure to work with this team, and being led by Jim and Maggie has been a great opportunity. So I want to thank you for that. Like any good product, you need to know whether or not you have a market. So what I really liked about this exercise that we've done with WeBet is that we were able to figure out exactly what is happening in this marketplace and whether or not this marketplace will have an effect on us at community colleges. And so to do that, we did a labor market information analysis. And at the same time, we did interviews with not only subject matter experts, but people that are actually working in the field at each one of the sites where the study is taking place. And so we have both informational data and we have qualitative data. And so I'd like to show you some of the results. So next slide, please, Maggie. Right, so to do a labor market analysis, and by the way, this is not my data. This is John Carice, who's a workforce director at the City College of San Francisco. So he is our guru on this kind of information. And what he has done is he's taken data from Burning Glass, and Burning Glass is a way of looking at and examining of job announcements. And so essentially what we did was we gave John some criteria, which was basically educational level. And what we're talking about is bachelor's and below. And we're looking at what experience are employers seeking. So top employers in the state with the most job postings were looked at, top job titles posted by cell and gene therapy companies, top specialized skills and baseline workplace skills most in demand by employers, and the trend line for these positions by the regions looking back 10 years. So we had in effect a time series analysis. And then what happened was, of course, we had COVID, and COVID was a bit of an interruption, but also, as you'll see in some of the data, it it messed with the data a little bit, but at the same time, we can show you that our numbers have shown great strength between 20 and 2021. So I'll go to the next slide, please. So here is the trend in the number of job postings, and you can see it by region or by state if you want. And you can see that the time series projection of the number of job postings using the criteria that we've discussed, as Jim likes to say, he knows what exponential growth looks like. And as you can see, if you look at 2010 to 2020 in the time series analysis, you can see for the most part that there is this nice exponential growth of these postings. So this to us tells us one thing, except for that little blip with COVID, that we've got a very great expanding market. And furthermore, when we looked at doing a more in-depth analysis for 2021, we went back to these regions and were able to look at the increases. And you can see in the bottom right-hand corner, you see the increase is no less than 19% at the state of Washington, with a huge increase of 46% in Massachusetts. So we're talking about a market that is rapidly expanding and needs a workforce. Next slide, please. So under some of the skills desired in the announcements, and this is in particular for California, but we could have showed you any one of the regions and you would see a very, very similar trend. But out of the announcements, you can see the skills and the knowledge that were required by these postings. And so by seeing these, you can get an idea. And of course, Jim has said aseptic, and cell culturing, but this comes up time and time again in our interviews with employers, but at the same time, it comes up in the job postings. So there's a perfect mirror of what's the expectation is with respect to specialized skills. I'm going to go to the next slide, please, Maggie. Thank you. So one thing that's important is educational level. And as we said at the outset, we looked at bachelor's and below. But the education, as you can see in the postings, comes up as right from high school or vocational training to associate's degrees to bachelor's degrees. And I think Jim has made a really wise comment that the more, and we're doing a lot of this with Innovate Bio as well, the more that we are able to have our community college graduates get into a workplace through a workplace program, the more the companies understand how valuable they are, and in particular that they have very, very fine hard skills. And we're working very, very, very well with them as well. We've heard this for time and time again on their soft skills. But I think what's very important here is the opportunity. We're ahead of the game here, and this is in our space right now. Next slide, please. So a great benefit of cell and gene therapy is that it's brand new. And so when they're looking for experience, these companies, they're actually not looking for a lot of experience. And the reason why they're not looking for a lot of experience is because it's new. And what they would like to do is have a person that comes in with the right hard skills and the right people skills, but they want to be able to train them up because this is new technology. So this graph is very evident of the potential for us if we can make sure that we have our people properly trained or properly skilled up. Next slide, please. So if you look at the employment projections for US companies based on cell and gene therapy extended out to the year 2030, you can see on the high side, it's almost a tripling effect. And on the low side, it's definitely a doubling effect. So we're very pleased with this labor market information. I hope you all are too, but for those of us who have cell and gene therapy in our areas, we're going to need to workforce up. So I think that's it. Maggie?
Thank you, Russ. Do we have any questions for Russ? Anything in the chat, Barbara?
Let's see. There was a question about what vocational training refers to in the previous slide, since there was high school or vocational training.
Yeah, I think in some states, there is biotech vocational training. And so, Jim, I don't know, and this is a California issue. You might want to jump in on this one.
Yeah, North Carolina, Russ, you're kind of the model for this with the bio network system. And it seems to me that this is a certificate rather than a full associate's degree. So we have certificates and we have a lot of students that jump out at the end of the certificate without doing the general ed to get to get an associate's degree. And that's what I think about. But one point I want to make is that what we really want to do nationwide is to develop an education pathway that is complete. And in California, we're making progress on this, so that we reach out into the high schools and we've articulated with the local high schools that have biotech programs, and then they come in with a lower level certificate and then a higher level certificate, and then add the general education. They have an associate's degree. In California, we've been able to, at the community college level, develop programs in biomanufacturing, and so they can seamlessly go into biomanufacturing. And then we've negotiated with graduate schools to accept all of those courses for biomanufacturing to go into graduate schools. And so there is an educational pathway from high school through PhD where the students can exit at any time, depending on what their family requirements are, and then re-enter or take the additional advancement part-time and have the company pay for it. And so I think that's what we should strive to do, to have multiple exit and entry points in a robust education system. And what I've always enjoyed about this particular field is that there is true ability for upward mobility within biotech. And so very, very often across the street from me, the head of Genentech manufacturing started out at technician level 1 and moved up. And so this is what we are in this for, right? This is the American dream. You take someone from a modest background, they work hard, you give them the skills, you give them the education, and then they move up. And so I think that's what they're talking about, Russ. They're talking about certificates pre-associates.
Yeah. Yeah. And Jim,